You're listening to the Pace Radio Network here at paceradio.net.
The views expressed by the individuals during this broadcast are their own opinions, and they may not be the same as those of their group or other organizations they may be involved with.
All medical advice during our broadcast is not a medical opinion and should be checked with your medical physician.
Oh yeah, baby, that's lovely.
Good morning. It's September the 19th, 2024, and welcome to Psychedelics and Cannabis Educational News. I'm live here from the Legacy420.com news desk at paceradio.net. Just as you noticed, I'm all by myself. That's because Glenn called in sick this morning, and Rev Cindy is in Mexico furthering her education on psychedelics. So today I'm going to go it alone. But as far as news-wise, I've got news from Health Canada. I've got cannabis taxes being put to work, how billions of dollars can be saved on healthcare due to cannabis. So plus more. So before, other than that, we should get right at her. And the first story of the day comes to you from StratCan, and it says personal designated medical registrations increase in early 2024 following years of declines. That's right. Number of people registering to Health Canada medical cannabis Canada continues to decline according to Health Canada's most recent quarterly report. In contrast, those registered for personal and designated cultivation of cannabis for their own medical purposes showed a reverse of this trend. Medical client registrations with federal licensed sellers fell 2% from 183,909 in December of 2023 to 180,878 in March of 2024. Such registrations have been on a downward trend since 2019, followed by a brief spike in 2020 related to COVID-19 pandemic and brief restrictions on accessing brick and mortar stores. Those declines were most pronounced in Ontario, Manitoba, Saskatchewan, and Alberta. Other provinces have shown a relatively leveling off for the past 2 years following a brief spike in new registrations in 2020. There you go. There's a chart here. You can see how things were going down there on the left. And on the right, how things have gone down, but have made some bit of recovery. Now, as far as the personal and designated production licenses go, it says similarly, active personal and designated production registrations have declined since the peak in September of 2021. That trend began to reverse in November of 2023 and increased month over month through March of 2024. The number of individuals registered with Health Canada for personal and designated cultivation of cannabis for their own medical purposes increased 15% from 13,672 to 15,726. Boy, that's even down from what it was years ago. Interestingly, this trend is seen in each province and territory as well, although increases were most pronounced in BC, Quebec, and Ontario. Health Canada also continues to note the number of grams per day associated with these personal and designated production licenses continues to trend much higher than the average gram per day associated with those registered to access cannabis for medical purposes from a licensed producer. The average daily amount authorized by healthcare practitioners for those accessing medical cannabis from an LP has been between 2 and 2.5 grams per day since legalization began back in October of 2018. Participants in the designated or personal production program have an average daily authorized amount of 34.5 grams, or about 15 times higher than the average daily amount authorized by healthcare practitioners. Now, as far as the authorized amounts by healthcare practitioners, they say that while there were 4,728 healthcare practitioners associated with registrations made in the previous 12 months with federal licensed sellers, there were 1,015 healthcare practitioners associated with active personal designated production registrations. So there's only $1,000 doctors that people can go to get their grow licenses, really. Of those 1,015, there were 233 healthcare practitioners associated with authorizing amounts equal to or above 25 grams per day, and just 10 authorized amounts equal to or above 100 grams per day. Most, 78%, of healthcare practitioners who authorized more than 25 grams a day were in BC or Ontario. All who authorized more than 100 grams a day were in BC and Ontario. And authorizations of 100 grams a day will equate to a limit of 487 plants at any given time. Such licenses can also be combined to up to 4 per location, meaning a designated grower with several authorizations could be growing hundreds or even thousands of cannabis plants with potential to produce the hundreds of kilograms of cannabis a year. And that, I'm going to say, this is where the municipalities are screaming about a loophole in the federal program because they're complaining about the numbers. Now, as far as inspections, they are up, and I'm going to get more into this in a further story. Now, as far as imports and exports of cannabis, the products, Canada continues to increase with the last month in the most recent quarter, showing a record amount of dried cannabis. Cannabis flower has been exported by more than 12,000 kilograms. Monthly exports of cannabis oil have also shown annual increases, although not as pronounced as for dried flower. Now, January 2024 showed a record number of liters exported, several times higher than the average at more than 3,200 liters of cannabis oil exported. You see the graphs right there. Wow. They say that imports and exports of cannabis to and from Canada are only allowed for medical and scientific purposes. Imports are very restricted, with a small amount of dried flower and cannabis oil ever making its way into Canada from abroad. Only 28 liters of cannabis oil and 28 kilograms of dried cannabis have been imported into Canada since 2018. That's it, 56 pounds. This compares to 45,286 liters of cannabis exported, cannabis oil that was exported, while 21,000 kilograms of dried flower was exported. I said maybe that comma's in the wrong spot. That could be 212,534. Now, the increasing amount of cannabis being exported from Canada, combined with an overall decline in the amount of cannabis being produced in Canada, has led to the wholesale cannabis market finally beginning to move from a buyer's market to a seller's market. And I look at that as that means prices are going up. This means a slight increase in how much the average cannabis grower will put in to get their cannabis. There you go. On the business-to-business market. At the same time, price compression at the retail level continues to increase, with consumers paying less and less for the average price of gram. Well, I can see that everybody's going to be paying more. So retail sales have also shown some leveling off and even declines in total dollars spent on cannabis in some provinces in the past year, potentially reflecting not only continued price compression, also declining volume, or at least selling off sales in some markets following years of year-to-year growth. I don't know if the price is going up at the business-to-business end. I can't see how the price can keep compressing down at the retail end, because then there would be zero markup, and nobody survives with zero markup. So, alrighty, from there, I'll move on to the next story. This one's coming to me from the marijuana moment, and I gotta believe it's got to be a good story. It's one of those good in the heart feeling stories because, according to the headline, New York marijuana officials announced $5 million in community reinvestment grants funded by cannabis tax revenue. So there's some money that's going back into the reinvested into the community from dollars that have been collected from cannabis tax instead of just going into your general slush fund, and maybe being used to pay for someone's orange juice while they were out for dinner. Business meetings, all that type of stuff. All right, here we go. New York State officials are preparing to deploy up to $5 million in grants funded by marijuana tax revenue as part of an effort to reinvest in areas disproportionately impacted by the war on drugs. The state's Office of Cannabis Management says the awards aim to redress a wide range of community needs, from housing to childcare to job skills, training, and many areas in between. Under state law, 40% of all cannabis tax revenue is earmarked for community reinvestment, targeting areas of the state that have been historically under-resourced, underserved, and over-policed. OCM said on a page posted at its website last week. The $5 million in grant money, to be divided into individual awards of $100,000, will focus in its initial round on providing services to young people from newborns to 24-year-olds and will fall into at least one of the three areas: mental health, workforce development, and housing. Now, according to the OCM overview of the program, they say that organizations do not have to be affiliated with any cannabis-related businesses or activities to apply, which is good news. Applications for the grants will be available later this year, with a request for applications expected to be released this fall, OCM said. Now, in the meantime, interested organizations can begin work on the pre-qualification application available at the state's website. Now, the office says, due to the length of time it can take to complete this process, which is typically 5 to 10 business days, sometimes it's longer, it is advised that interested nonprofits pre-qualify as soon as possible. Awardees will receive the funds over a 2-year period, with a portion being dispersed in a one-time advance payment and remaining funds distributed via quarterly reimbursement-based vouchering. Now, continues to say that to ensure limited resources are available to areas of the state where funding can have the most impact, the 2024 grant cycle aims to prioritize funding to counties identified as high need for youth-oriented services and as historically under-resourced and over-policed. Additionally, OCM and the Cannabis Advisory Board intend to make at least one award within each Empire State Development region to ensure geographic distribution of awards across the state. Now, the announcement of the forthcoming reinvestment grants comes just weeks after the New York Governor Kathy Hochul touted the state's smoking hot marijuana sales numbers as the market reached an all-time high of over $500 million in legal cannabis purchases since adult use retailers launched in late 2022. Well, maybe there's going to be more money coming down the pipe instead of just $5 million. New York has seen about $370 million in purchases this year as of numbers released last month. Combined with last year's totals of about $160 million, this brings the net sum of roughly $538 million since the state market launched in December of 2022. So there you go. Some money that's been going back into the community. Now, they say that certain advocates say that Hochul has falsely blamed legalization law itself for the state's troubles with the illicit market, without taking responsibility for the administration's role. That's all these delays. To the end, there has been criticism of the governor's ousting of Chris Allenders as executive director of the OCM. In an attempt to reinforce unlicensed sales, the governor in February called on big tech companies such as Google and Meta to do the right thing by taking steps to stop promoting illicit cannabis shops, which have proliferated across the state. Well, when you're doing things slow and half-assed, yeah, that happens. And they even had the farmers markets, where because the stores were opening so slowly, they had this farmers market for legal businesses. Meanwhile, New York officials are rolling out a broad plan to encourage environmental sustainability and set energy use standards within the state's legal cannabis industry. It's part of regulators' broader goal of promoting economic, environmental, and social stability in the emerging sector. So let's see what it says here. In June, state regulators also formally approved rules to allow adults 21 and older to grow their own cannabis plants for personal use. So yeah, there you go. Some money that's coming back into the community, and it's going to help people. As it mentions, housing, and we're all hearing about the housing situations, no matter what country we're in. All righty, close that story off, and we'll move on to the next one. And this one is coming to me from the Green Market Report, and the headline on it says, EU initiative begins to bid to open access to psychedelic therapies. There you go. Spreading wider and wider, and these psychedelic therapies are coming in quicker than the cannabis ones. And I'm thinking, is it because most people smoke cannabis? Not everybody does, but the smoking problem. They say that European Citizens Initiative aimed at promoting psychedelic-assisted treatments for mental health disorders have been registered by the European Commission. The initiative, dubbed Psychedelic Care, was registered on September 11th, according to the European Commission's official website, in a bid to establish a transnational legal framework around psychedelic therapy in the Union. Psychedelic Care initiative will be an amazing participatory democracy tool to put pressure on the EU to finally take action on the medical use of psychedelics, says Theo Gabella, founder and organizer of the initiative, said on the group's website. The initiative proposes several objectives, including supporting the establishment of an expert consensus on standards of psychedelic care and psychological support, therapist training, and ethical guidelines and safety measures. Sorry, I got the hiccups. It also aims to boost EU-funded research with the therapeutic applications of psychedelics to strengthen the evidence of their safety and efficacy, and adopt common positions within the UN fora to advocate for pragmatic, progressive transnational regulations concerning psychedelic compounds. Organizers cited data from the Organization for Economic Cooperation and Development, estimating the economic impact of mental illness at 4.2% of the EU's annual GDP, or about 600 billion euros per year. The group argues that up to 50% of patients do not respond to current available psychiatric treatments. Now, the organizer says the EU has approved only one new psychedelic treatment in the last 3 years, in stark contrast to the 68 approvals in oncology. Now, to succeed, the initiative must collect 1 million signatures within a year and meet minimum thresholds in at least 7 EU member states. Now, the organization says, we call on the commissions to recognize the unique specificities of psychedelic therapies and their potential to meet high unmet needs for mental health conditions and substance use disorders. Now, the group noted that the U.S. Food and Drug Administration has already granted several breakthrough therapy designations for MDMA, psilocybin, and LSD treatments. Canada also allowed psychedelic-assisted therapy for end-of-life anxiety in 2022, and there's complaints about that. While Australia recently authorized prescriptions of MDMA for post-traumatic stress disorder and psilocybin for treatment-resistant depression. This news follows the European Medicines Advocacy call earlier this year for psychedelic drug developers to target the EU market. The proposal also calls for the creation of a European Union for mental health research and development and the implementation of incentives to spur innovation in the field. And what's good to see, spur innovation. It's to get things going, get all this, get the research going, and that's perfect because that's what they're always saying. There's not enough research. There's not enough research, and knowing that people are doing that research, that's good to know because it will come out eventually. Alrighty, I'm halfway through. It's medication time, so I'll be right back. And after I medicate, you'll be watching Psychedelics and Cannabis Educational News. We're live here at paceradio.net. You're listening to the Pace Radio Network here at paceradio.net. Limestone City Hydroponics is Kingston, Ontario's hydroponics shop. Take your growing to the next level and create the optimal environment with a tent kit or maximize your yield with an ebb and flow flood table kit. Either way, Limestone City Hydroponics has more sizes and options to fit your needs. Are you looking for the power of the sun that adapts to your budget? Then look no further as they have professional grow lighting. They have indoor grow systems that are easy and cost effective with many options to fit your living space and lifestyle. Cultivate your growing potential. We have everything you need to succeed. And if you can't make it to the store, they offer local delivery to the greater Kingston area. Remember, when you're looking for experts to help you grow, then look no further than the locally owned Limestone City Hydroponics, 105 Sunderland Drive in Kingston, Ontario. Call them at 613-548-0420.
Are you looking to get your medical cannabis grow license? Limestone City Hydroponics can help patients through the process of obtaining their license to grow medical cannabis. What's that? You don't have a doctor. If you meet the medical criteria, Limestone City Hydroponics has a nurse practitioner who can assess and provide medical cannabis prescriptions. What are you waiting for? Contact Limestone City Hydroponics at limestonecityhydroponics.ca or call them at 613-548-0420.
What do you find at paceradio.net? People advocating cannabis education.
Enjoy the buzz of legalization with Campbellford Lifestyle Shop. From lights to plant nutrients, books, consumption accessories, and more. We've got all your basics to grow or consume cannabis. Visit our info center or take a look at our piercing services and body jewelry, now available in-store through Campbellford Lifestyle Shop, 17 Bridge Street West, Campbellford.
Are you looking for non-stop, continuous cannabis and psychedelic programming? If you are, then turn your browsers to 420radio.ca or paceradio.net, where you will find the 420 Pace re-rolled Saturday. Everything gets started at 8 a.m. Eastern Saturday morning.
Cannabis edibles are an effective way to manage pain and other ailments, especially when you deal with your trusted partner, Legacy 420, in Tyendinaga Mohawk territory. You see, we lab test every product on site to ensure proper dosage every time, which is critical when consuming cannabis edibles. All Legacy 420 edibles are made by our classically trained baker and chocolatier, and we also have super tasty vegan options.
Our baker has been in the industry for 25 years. She's also a chocolatier. Everything from savory to sweet, your chocolate bars, brownies, butter tarts, you name it, we make it.
Talk to our knowledgeable Cannatex about our incredible variety available. Give your trusted partners a call. Legacy 420 out on your road.
You're listening to the Pace Radio Network here at paceradio.net. Hey, I'm back. I'm live, and I'm still smoking my medication. But hey, I'll still bring you some news. Here we go. Talking about news. First story after the break comes from StratCan. As I mentioned earlier, we're going to talk about some cannabis inspections because Health Canada cannabis inspections report from 2023-2024. The number of inspections of federally licensed cannabis facilities and license holders in the 2023-24 fiscal year was on par with the previous year, but targeted inspections increased notably. Now, Health Canada conducted a total of 662 inspections of cannabis license holders in the year ending March 31st of this year, including 160 inspections of registered personal and designated production of cannabis for medical purposes. I don't think I've ever heard of numbers. I know I have numbers at 160, but over the years, boy, they were really, really small in those early years. This number is on par with the 662 inspection activities in the previous year, 170, which were of registered personal and designated production for cannabis medical purposes. So from year to year, they went down, but early on, back in the MMAR days, there wasn't many inspections happening whatsoever. Targeted inspections increased significantly from the previous year from 18 to 101. There's a huge jump. A targeted inspection is conducted to assess specific issues at a licensed facility. In addition to the 160 inspections of registered and designated production licensed sites, the regulator also conducted 20 compliance and enforcement activities, other than the inspection itself, for registered personal and designated production of cannabis for medical purposes, such as conducting seizures and destructions. In the 2023-24 fiscal year, Health Canada also issued 21 non-compliant inspection reports to license holders for issues such as non-compliance related to good production practices, unsatisfactory retention of documents and information, and not conducting activities as per their responsibilities. It issued 15 of those in 2022-23. So those numbers are up. Health Canada also issued 3 warning letters to formally advise license holders of their non-compliance and to request corrective measures, conducted 5 seizures and detentions of products, and issued 2 administrative monetary penalty recommendations and 2 notices of violation. While there were only 5 instances of sampling in the previous year, there were 113 sampling activities conducted in the most recent year. Health Canada can take product sampling for testing to confirm they pass for things covered by federal regulation, such as microbial and chemical contaminations and pesticides, and follow up on reported adverse reactions and complaints. In late 2023, Health Canada confirmed it had also conducted targeted inspections to verify reported THC levels. Health Canada also conducted 31 industrial hemp compliance monitoring project inspections and 24 plant breeder compliance monitoring project inspections. The inspections results were all compliant. And there's a graph right there shown in the provinces. Of the 160 inspections of registered personal and designated production of cannabis for medical purposes locations, 74 were in BC and 63 were in Ontario, 18 in Quebec, and 5 in New Brunswick. In the previous year, the majority of such inspections, 115 out of the 113, were in Ontario. Wow. Of those inspections, in the most recent fiscal year, 93 received a level 3 rating. I wonder what that is. We'll find out, hopefully. 17 received a level 2 rating, 36 received a level 1 rating, and 14 inspections were not rated. Here we go. A level 1 indicates low risk, whereas a level 3 indicates severe risk. So 93 at the severe risk, and 36 received a number 1. That's not good. We like to see those low risk numbers be much higher. Based on these inspections, Health Canada revoked or refused 29 registrations. The agency says additional actions are currently ongoing or under consideration. It revoked or refused 16 in the previous year. Now, Health Canada also monitors the market to ensure federal license holders adhere to federal promotional prohibitions. Of the 243 cases of potential non-compliance related to promotions expected between April the 1st of 23 and March the 31st of 24, there were 134 actions, 84 compliance emails or letters, and 45 compliance promotion emails or calls, but no administrative monetary penalties were issued. So there you go. That's a further in-depth report on those inspections, and that was going to be in the other one. That's why I held off waiting to be able to go through that with you, because at one time, like I said, in those early years, we never heard of any inspections, and it wasn't until it really got a lot of press about it before things really started to hire more inspectors in order to go around and inspect personal gardens. So, alrighty, on to our next story. This one comes to me from Marijuana Moment. Nationwide legalization of medical cannabis could save $29 billion in annual health insurance costs, according to a study. $29 billion. That's a lot of funds, man. That's a lot of funds, buddy. That's right. New research by the medical cannabis company Leafwell suggests that state-level medical marijuana legalization may significantly reduce health insurance costs. In states with legal medical cannabis, companies paid 3.4% less for health insurance premiums compared to where cannabis remained illegal, a savings of about $238 per employee per year. If all states were to implement medical cannabis programs, the study says the country could save an estimated $29 billion in health insurance costs annually. Now, Leafwell's chief medical officer, June Chen, says in a statement that this report strengthens the case that investing in cannabis care isn't just beneficial to patient care, it's also good for business efficiency. By including cannabis in insurance plans, employers can foster a more inclusive and supportive work environment, enhance employee satisfaction, and ultimately contribute to a healthier, more resilient workforce. Now, the study published this month in the journal Applied Health Economics and Health Policy looked at data from an annual surveys of employers analyzing a period from 2003 to 22. Now, they say, the company in a release says that over the first 10 years of a state implementing medical cannabis laws, we found evidence of reductions in health insurance premiums for single and employee plus one coverage plans. And they say also, in addition, the lower single employee premiums cost of employees plus one coverage plan was $340 lower per employee per year. Now, taking into account both single employee plus one plan plans, as well as savings to both companies and their co-workers, Leafwell said nationwide medical cannabis legalization could ultimately save that $30 billion, like $29 billion in healthcare costs, $22.9 billion among employers, and $6.5 million among workers themselves. That's a lot of dough, people. A lot of dough. Now, according to the team, they say that under a hypothetical scenario where all 50 states adopted medical cannabis in 2022, we estimate that employers and employees could collectively save the billions in healthcare coverage, potentially reducing healthcare expenditures contribution to GDP by 0.65% in 2022. Now, they also say the company says this research also supports positive social changes. And in the research, they say by looking at how cannabis laws affect healthcare costs, we can create policies that focus on improving public health and health equity. That's right. Give people some more of their money back. Now, adoption of medical cannabis law may contribute to decreases in healthcare costs. The report concludes, and this phenomenon is likely a secondary effect and suggests positive internalities outside of medical cannabis patients. There we go. And now, a year ago, a separate report in the International Journal of Drug Policy detailed similar findings. So there you go. It's not the first time. While reductions in health insurance premiums were modest immediately following legalization, the study found that by 7 years after implementation, annual premiums had fallen by $1,663 compared to states in the control group. Similar reductions were seen after 8 years and 9 years, indicating the decline in costs were fairly stable over time. So whether you consume cannabis or not, you're gaining this as a benefit, getting a reduced fee. Never mind what the costs of not covering pharmaceuticals because the patient is using cannabis. They say, although the effect does not begin until 7 years post-medical cannabis law implementation, the authors of that study concluded there is a significant, sizable reduction in health insurance premiums in states that legalize medical cannabis. So there you go. It just, savings. They're always talking about, healthcare is costing so much. Well, hey, get some more cannabis involved in it. And those costs could, by that report, those costs can go down. And it's not the first time. They've been saying over the years and how opiate prescriptions have been reduced. Those prescriptions were covered by health insurance. Then those costs aren't as severe. I'm a perfect example. People didn't have to pay for my healthcare. Policy didn't have to cover my opiate prescription because I didn't have one, other than when I was hospitalized. Right, so there's that cost. There's big savings that are available there as well. All righty, on to the last story of the day, and this comes to me from the International Cannabis Business Conference. And as you can hear, the dog is barking. She wants out outside, but she still wants off the deck. All right. Germany, Judiciary examines nearly 280,000 past cannabis cases. Like 280,000 they're going to review instead of making each one of them do it one at a time like we did here in Canada. Now, Germany's judiciary recently announced that federal states have reviewed an estimated 279,000 past cannabis cases after adult use legalization took effect in Germany on April the 1st. Starting then, adult consumers in Germany can cultivate, possess, and consume cannabis with certain parameters. The most populous federal state, North Rhine-Westphalia, has the most reviews at 86,000, followed by Bavaria at 41,000 and Hesse at 34,000. The smallest federal state, Bremen, has the fewest criminal records reviewed, 531. I reported the paper there. Cannabis prohibition previously cost Germany 1.3 billion euros a year, according to analysis by the Institute for Competition Economics at the Heinrich Heine University in Dusseldorf. Reviewing old cannabis cases is a massive undertaking in Germany, and the number of reviews is a testament to how many lives were needlessly harmed in Germany due to prohibition. According to the evaluation, the judiciary in Bavaria has re-examined 41,500 cases, and the courts have so far received more than 6,200 cases for redetermination of sentences. The courts have already made a decision on this, and in around 3,500 cases. The Hessen authorities have already imposed sentences 450 times, and the sentence has been redetermined in a further 88 cases. Meanwhile, in Bavaria, reported 33 cannabis consumers have been recently released from incarceration thanks to Germany's new cannabis laws. I'm just laughing at my puppy. Now, according to a report from the German Cannabis Business Association, since the partial legalization of cannabis back on April the 1st, incarcerated cannabis users have been released from prison in Bavaria. The release of the cannabis prisoners in Bavaria was first reported in a local paper there. In addition, the cannabis being legal for adult use in Germany, recreational cannabis is also legal in Uruguay, Canada, Malta, Luxembourg, and South Africa, as well as at the local level in certain parts of the Netherlands, Switzerland, and the United States. So there you go. It's always good news that when they're reviewing those past convictions, when they're automatic, when they change cannabis laws, it's just nice that some of them done just automatically with a swipe of pen. Here in Canada, it was a little more longer process where each person had to be done individually. There's been some work done on that, but the last I had seen on it, it wasn't just written off like it is in a lot of the U.S. states. So, alrighty. Well, other than that, folks, that's it. I've done. That's the Pace News Report for the September the 19th from the Legacy420.com news desk. And thanks to our buds at the Campbellford Lifestyle Shop, Limestone City Hydroponics.ca, At-Eze.ca, and Legacy420.com. And in closing, I'd like to say thank you for watching or listening. Plus, don't forget to educate, medicate, and do not incarcerate.
You're listening to the Pace Radio Network here at paceradio.net.
The opinions of the individuals during this broadcast are their own, and may not be the opinions of their group or other organizations they may be involved with. All medical advice during our broadcast is not a medical opinion and should be checked with your medical physician.
When you have a pain that's reached its peak, Legacy for 20 is so unique. If organic cannabis is what you seek, here's your trusted partner 7 days a week. Suppository salves, vapes and drops, topicals, edibles, infused pop. Just when life seems like it ain't easy, at Legacy 420 enjoy a pop freezy. Lab tested products make them the GOAT. Legacy 420 out on your road. Legacy 420 in Tyndonega Mohawk territory. Indigenous organic cannabis at its finest.
Enjoy the buzz of legalization with Campbellford Lifestyle Shop. From lights to plant nutrients, books, consumption accessories, and more, we've got all your basics to grow or consume cannabis. Visit our info center or take a look at our piercing services and body jewelry, now available in-store through Campbellford Lifestyle Shop, 17 Bridge Street West, Campbellford.
Limestone City Hydroponics is Kingston, Ontario's hydroponics shop. Take your growing to the next level and create the optimal environment with a tent kit, or maximize your yield with an ebb and flow flood table kit. Either way, Limestone City Hydroponics has more sizes and options to fit your needs. Are you looking for the power of the sun that adapts to your budget? Then look no further, as they have professional grow lighting. They have indoor grow systems that are easy and cost effective, with many options to fit your living space and lifestyle. Cultivate your growing potential. We have everything you need to succeed. And if you can't make it to the store, they offer local delivery to the greater Kingston area. Remember, when you're looking for experts to help you grow, then look no further than the locally owned Limestone City Hydroponics, 105 Sunderland Drive in Kingston, Ontario. Call them at 613-548-0420.
We are people advocating cannabis education here at paceradio.net.